Welcome to week 4. I hope you're doing okay and having a great week. This week we're looking at chapters 5 and 6 in the text, and it's talking about the different types of syndromes and disabilities, such as developmental disabilities and hearing or sensory disabilities that includes hearing and vision issues. In chapter 5, it discusses developmental disabilities, as I said. Something that you should know is that Oklahoma lets school district decide individually by each year by July 1st as to whether they will utilize definitive categories for children from birth to, from ages 3 to 8. No, actually now it's ages 3 to 10, or if they will utilize the term developmental delay to effectively serve these children. It has been my experience over the years that the term developmental delay is much more appropriate for these children. No service provider, special education teacher, or administrator wants to utilize the term intellectually disabled or mentally retarded. And of course, that's the old term that's still in some literature, and you still hear it when you're referring to children with a disability. And of course, then you also hear it as a slang, and I think I have something posted later in the semester about when is it appropriate to use the word retarded, and pretty much never. So just so you know. Let's see, many children, when they're that age, when they're provided appropriate interventions at the preschool level, they end up not needing to have special education later in life or as they progress through school. So that's another valid reason for using the term developmental delay rather than intellectual disability or mental retardation. I wanted to share just briefly with you about my oldest son, Michael. I mentioned him week 1, or I mentioned him in my introduction, and then you saw a picture of him in the week 1 PowerPoint. Along with his younger brother Daniel. Michael's now 30 and Daniel's 25. Michael and I both nearly died when he was born because my placenta abrupted and he was without oxygen for several moments. And then, of course, I also had issues. Anytime there are issues with your placenta, it can cause internal bleeding and that sort of thing. I was already in the hospital because my water had broken, so they rushed me to surgery, did an emergency C-section, and as I was counting backwards to wait for the anesthesia to take effect, I actually felt the incision. I know it was not fun. I don't remember anything after that point, and I don't know if I passed out because the anesthesia took effect or because the pain was too much. But anyway, either way, I was out. The next thing I remember is waking up and hearing the doctor tell Michael's dad that he didn't know if he did us any favors by saving him, that he thought he would probably not be much more than a vegetable. Fortunately, most doctors don't say those terms anymore. That was 30 years ago, like I said. When Michael was born, he was blue. He was having seizures, and they also gave him a blood transfusion because he was having seizures and had turned blue. But that was before they routinely checked for AIDS and that sort of thing. But fortunately, we've not had any issues with those kinds of things through this point, and don't expect to. Let's see, the doctor, I already told you about the vegetable. Fortunately, he was in very good care. His pediatrician was amazing. He's just recently retired, and his name's Dr. Wright. Some of you in the Stillwater area probably know him. And he may have been your pediatrician. And what I loved about Dr. Wright is he just always adored Michael, and he had these little stickers with a baby pistol Pete on them when he first had his practice, and it said, and the kids would get them and they'd stick on there, and they'd have the little Pistol Pete on it, and it would say, "I saw the right doctor." And I just thought those were so cute. Anyway, long story short, since Michael was full term, he only stayed in the NICU, the neonatal intensive care unit at OU Children's Hospital, for 2 weeks. And he had a lot of feeding issues and those sorts of things, and definitely was delayed, but certainly not a vegetable. I'll talk more about Michael as the semester progresses, but that's just kind of how things started out with him. And then Chapter 6 goes into detail about vision and hearing impairments. Frequently, young children with these issues are not always identified early unless their impairment is complete or total blindness or total hearing loss. Through screenings that are a part of appropriate early childhood programs, many children with these sensory impairments are identified and served effectively. Sometimes children with significant sensory impairments have difficult behaviors because they haven't learned yet how to manage their disability. Last year, my program enrolled a child with a hearing impairment who had been kicked out of other programs that were designed for children with disabilities because they couldn't handle his behavior. After just a few weeks in our program, he felt safe and loved coming to school. The teachers helped him feel safe and secure and helped him understand what was going on around him. People with sensory impairments appreciate when people are open and honest with them and don't treat them differently. My own youngest son, Daniel, when he was 3, saw a blind gentleman that I worked with on almost a daily basis. He was very curious about this, so I asked my coworker how he would like to handle it, and my coworker wanted Daniel just to ask him about it, so he did. And Daniel was impressed about how the gentleman was able to get around and know where he was going and what he was doing, and it helped him grow a true respect for people with differing abilities. As you're doing your assignment this week, you'll see that it's a 2-page paper. You pick any of the conditions or syndromes that are discussed in either chapters 5 or 6, and just talk about that syndrome. And let me get the exact directions. I can't pull it all up at the same time on my computer as I'm looking at it. Week 4 assignment, due February 8th. After reading chapters 5 and 6 in the main course text, pick one of the major syndromes, conditions, or disabilities discussed in the chapters and write a 2-page paper discussing the main elements of the disability, the prevalence, possible interventions, and at least 3 resources for families of children with your chosen disability. This is also one of the assignments that needs to be turned in to turnitin.com. So make sure that you've done that and that it is already set up in the system for that, but you also need to submit it through Blackboard as well. I'll just look at it and turn it in to make sure that it's your original work. And if there are any questions, as usual, I've gotten a few texts from you guys, and I appreciate that you're staying on top of things. So make sure you're contacting me if you have any questions. You've got my text. I also look at my email every day. Sometimes, since Blackboard doesn't always notify me when there's a message, if you're needing to get a hold of me right away, go ahead and text me, because it might be several hours between times that I look at Blackboard to see if there's a message. So anyway, y'all have a wonderful week, and I will see you next week.